Hello, my name is Sarah Burnett, and I'm a senior at the University of Tennessee studying biology and public health. Today, I'm going to talk to you about India's initial response to COVID-19, how effective this response was, and recommendations for India to improve future health crisis preparedness. So as we're all too familiar with at this point, a virus called SARS-CoV-2, which causes COVID-19, began spreading around the world rapidly near the beginning of 2020. The spread of COVID-19 prompted many governments to implement various non-medical interventions, such as mask wearing, social distancing, and limits on gatherings in efforts to slow and stop the spread of COVID-19. The effectiveness of these interventions and their enforcement varied greatly across the world. So I conducted a literature review examining India's response to COVID-19 specifically and how effective it was. I chose India for this review because India has a really large population of 1.3 billion people, making it the second most populous country in the world. And India also implemented the strictest lockdown measures in response to COVID-19. So it's helpful to kind of have a background understanding of India's pre-pandemic healthcare system. So India has been working towards establishing universal health coverage, but hasn't really made any significant progress towards that. Additionally, as you can see in figure 1, in 2019, India lagged far behind the most developed countries in the world on some key health indicators. And further, healthcare quality and access isn't equally distributed throughout the country. So while about 2/3 of India's population resides in rural areas, the majority of health workers are located in urban areas. Finally, throughout the end of the 20th century in India, commercialized secondary and tertiary models of care were emphasized, weakening India's primary care system, disease surveillance, and epidemic early warning mechanisms. So when COVID-19 began in response, India implemented several sequential lockdown and unlock phases as shown in tables 1 and 2. So lockdown 1.0 included the strictest regulations of anywhere in the world. And during this lockdown phase, most Indians were not permitted to leave their homes and only absolutely essential services were continued. So each following phase loosened some of the prior restrictions with some variation based on local conditions and local leadership. There were variations in response and enforcement across different regions of the country, as well as variations in access to needed supplies like PPE. So despite nationwide mandates, there was not a unified national response. These measures taken were effective at slowing the spread of COVID-19. So if we look at table 3, it demonstrates changes in estimated health metrics determined using mathematical modeling. We can see that there was a significant decrease in R0, as well as a substantial increase in the virus's doubling time from the beginning of lockdown 1.0 to the end of lockdown 4.0. It's also been estimated that these lockdown policies delayed the peak of COVID cases in India by about 100 days. This is really significant because it allowed time for India's healthcare system to prepare to treat COVID patients in need of medical care, and it prevented a greater burden on the system, allowing those with other medical conditions to receive the treatment they needed as well. And this certainly prevented many deaths in India. So figures 2 and 3 exhibit the daily number of new cases from the beginning of lockdown 1.0 to the end of unlock 6.0. We do observe an increase until about September of 2020, which is partially due to increased testing capacities, as well as a true increase in cases. But again, this peak was delayed significantly by the non-medical interventions that were implemented. I concluded this literature review in November of 2020, but I've included some visualizations of case counts in India since then. So as you can see in figure 4, there was another larger surge in COVID cases around May of this year. This surge was likely driven by variants, as well as further relaxations in restrictions and regulations in India, people going out more and just being around more people. India didn't implement another nationwide lockdown, but local guidelines did aid in the drop of cases during the summer, finally concluding this surge in mid-summer 2021. So when we're considering areas for improvement, it's helpful to consider countries that have been successful in responding to COVID-19. So one of these countries is Australia, and Australia's strong response was largely due to their strong primary care system. As mentioned earlier, India doesn't have a strong primary care system. So similar to India, China also saw an emphasis on secondary and tertiary care towards the end of the 20th century, which weakened their primary care system as well. But prior recent epidemics in China brought this to China's attention, better preparing China to make modifications to its pandemic response during the COVID-19 pandemic. Developing a better primary care system, as well as a unified response system, will better prepare India to combat future health crises like COVID-19. Thank you.